And I'm very pleased this evening to introduce my colleague from George Washington University, Dr. Neal Sikka, who's a professor of emergency medicine and a very active clinician, but whose research is fascinating as well. And I don't think I've ever met anyone quite like Neal, who utilizes his practice in such an effective way to ask critical questions about alternative approaches to healthcare, how we can really facilitate people's access to healthcare that addresses very important issues of, in particular, about cost and benefit of various interventions in various settings. And as Lynn indicated in her announcement to you, he is chief of the department's innovative practice and telehealth section, where he leads telehealth efforts. And he was the founding chair of the American College of Emergency Physicians Emergency Telehealth section, and is a member of the newly created Center of Excellence for Telehealth and Aging. And I think that couldn't describe better the focus of the Health Committee for Georgetown Village in terms of our interests in trying to maintain people in their homes and provide them sufficient access to good information in regard to healthcare. So how to utilize the internet favorably, how to utilize telehealth to its utmost advantages. And so without taking more time, I'm going to let Neal continue. He's going to give us an overview tonight of technology-enabled healthcare, and he's particularly anxious to get feedback. I mean, I think we all say that when we get introduced as speakers, but I think he really means it in the best way, not just to make sure he's answering our group's questions, but to make sure he knows where the future of this series could go, so that he can advise us best on how to deal with other issues in technology-enabled healthcare. So with that as an introduction, Neal, thank you very much for doing this evening, and we look forward to how our members might help you as well in your research efforts. Dr. Neal Sikka.
Thank you, Dr. Rickles. That was, I appreciate that introduction, because I think that's exactly so accurate. You probably said it way better than I would have ever said it, because we are trying to understand, how can we bridge the digital divide, which is not necessarily about technology and devices, but really about knowledge and confidence in using those devices. And so some of the things that we talk about this evening, you may know, some things you may not know, and I hope that you share them with others, or ask someone who might know more and learn more, or come to us and learn more, to improve your skills in navigating healthcare through technology, because it's only going to become more pervasive. So also, just really quickly, I want to introduce, I have Sarah Belay. She's one of my research assistants working on our project called Health Desk, which is all focused on digital health literacy. And I believe David Lee, who's also here, he's also one of my research coordinators, working with us on these projects. So I appreciate them coming as well. And I'm going to share my screen. All right. Is my screen coming through okay?
Yes.
Awesome. Okay. So I think we've done introductions, but hopefully I won't see you all where I work clinically. I work in the George Washington University Emergency Department. Everything we do is really informed by the patients that we see and take care of and the conversations we have. And through our research and some of the work we're doing in the community, really hearing from patients and trying to understand how we can help them the most. I spent yesterday evening in the ER, and I helped a woman download her patient portal because she said, I have my medication list here. It's somewhere. And then we looked through all her bags and everything she had with her, and we couldn't find it. And we were lucky we were able to access her portal for her for the first time. And then she was able to share her medication list. And she was so happy. And I feel like that you see the example there of how enduring technology is, because now that she has access to her portal, she will always have access to her portal and her medication list, rather than that sheet of paper, which is somewhat ephemeral or transient in some ways. So let's see if I can advance this. All right, so our objectives tonight are threefold: to identify kind of good online health information, some strategies for doing that, understanding the value of patient portals, and optimizing your telehealth visits. So we'll spend a little time in each one of these, and then have time to do some Q&A. So I'd like to always kind of start with talking about healthcare trends. And I have to say, I've been giving lectures on healthcare trends and technology and healthcare for maybe 15 years. And this slide doesn't change so much. Things move slowly, it seems, at least from the healthcare provider's perspective. But one of the major things, and I heard this probably in 2008 from someone speaking at a conference, and I've carried it with me for a long time, these two first bullets. So, probably when I was growing up, when we were growing up, we always thought of seeing our doctor as basically, sick care. You'd go to the doctor when you were sick. Maybe you had an annual physical. So typically you would see your doctor once or maybe twice in a year. And with technology, with kind of the change and the evolution of how we're navigating care today, we are slowly inching towards a much more continuous connection with the healthcare system. And technology enables that, the ability to track information or message with your provider, a variety of more touch points that are now possible than ever before. And that changes the paradigm and the intervals that your doctor is looking at you and your data to make decisions. The next one is observations of daily living. And this is the concept of, maybe you still do this, or you used to do this. If you went to your doctor and you had high blood pressure or you had diabetes, you would write down the blood pressures that you may have taken at home and take it with you so your doctor could review that information and make some kind of management decision about your medications, for example. But now we can do that in a technology-enabled way. You can track any observation, not just blood pressure or glucose, but you can track your temperature on a continuous basis. You can track your steps every day. You can track your activity, your diet, everything is trackable. And so these observations of daily living can now be incorporated into your care. And those are all enabled by things like sensors and wearable tools. Probably the simplest example is, your smartwatch. My watch is tracking my steps. It tracks how many minutes I exercise each day, how many extra calories I burn from that exercise. And I use that information as a marker of my good days. So for example, today was a difficult day. I was very busy. I did not get to work out, and my circles are barely halfway. So I'm going to have to figure out what's going to happen tonight to try to close my rings. But when I do that, I feel better about myself, and I know that I have accomplished certain goals for movement or activity in the day. And then the last is all about patients, and patients have become consumers of healthcare and have so much more access to information, whether it's through Google or other sources, through Amazon and other service providers, products you can purchase, devices that are in the non-prescription space, and then, YouTube videos, knowledge. It's transformational. The dynamic is, in healthcare, it used to be the healthcare system knew everything, the patient didn't know so much, but that's equalizing because the information is completely available to you, and we're there to help you interpret it more than we are to just deliver it. So those trends, they're slow and continue to move, but I think they're important to recognize in the background of how we think about technology-enabled care. And this is a complicated slide. I use this with a lot of my students and engineers, but I thought I would put it up here just as a way to represent what we're talking about tonight. So I use two terms. They're very interchangeable in my mind: technology-enabled care and digital health. And I think if you look at kind of the consumer marketplace and the healthcare marketplace, they're both starting to use this term digital health. And really, what does that mean? I think digital health encompasses a lot of different things. So it can encompass wearables like we talked about, a watch, health apps that you might utilize, your electronic health record that your doctor records, your information into, things as complicated as biomarkers and genomics, to things as maybe we consider removed from healthcare, but social media and social networks as a source of getting health information. And then wireless communication, of course, bridging all those things together. And then, and those are supposed to be in our hearts, patient-centered. We want to make sure that all these technologies enable patients to get better care and be healthier. And then we have things that are emerging. So some of the research we're doing in virtual and augmented reality and how that can help patients, artificial intelligence, big data, who knows what the next big thing is. But one of the underlying things, and what we learned during the pandemic, was that there are a lot of health disparities. And while honestly, many people across the spectrum have access to technology and devices, the divide is that knowledge gap, that we have very unequal knowledge, confidence, and abilities to utilize that technology to improve our health. And so that's what our goal is. We've kind of termed that digital health coaching, ways to do some one-on-one or group coaching to improve those skills. So now we'll get to some of the more practical parts of the talk tonight. And the first is talking about online health information. And this is not necessarily a topic that we used to talk about a few years back, but became very, very prominent again during the pandemic. And that is that there was so much misinformation, difficult to understand information that became available and potentially politicized, to potentially the negative health outcomes. And so it's not my job to tell you which information is necessarily the best information, but is to lead you to sources that I think are reliable and credible for you to interpret that information. And so that's what we want to talk about here. So reliable, credible, accurate information is the most important for you to be able to find and access. And of course, if you find good and credible information and you share it, then you're not sharing misinformation, which propagates upon itself. So I'm going to share a short video. We use a style of video here where we talk to our patients that we find on the street. So really our community members and our colleagues and our peers, and we ask them how they're thinking about these questions. And we use that as a way to kind of open a conversation about how to find the best health information.
Do you ever use the internet to search for health information? So do we. But you want to make sure that when you're searching for health information that it is current and reliable.
You may want to go to websites that end with .gov, government sites that are credible and reliable, such as the CDC, the Centers for Disease Control and Prevention. They have lots of great information that's easy to read and most up to date. There's also sites like the NIH, as well as professional organizations. For example, I'm an emergency room doctor, and our organization, the American College of Emergency Physicians, has great information regarding emergencies. There are also other organizations you may have heard of, like the American Red Cross, the American Heart Association, and other professional associations associated with a specialty. Do you ever search for health information on your phone?
Yeah, like if I'm looking for like a specialist, or if I'm looking for a clinic.
Have you ever used your phone to help search for health information?
Yes, I have. I've used the portal at dwdocs.com because sometimes they have blogs on it. Also, I check YouTube to see if there's any information about procedures coming up, so I'll know how it is.
How about any websites you trust? Ever go to any websites to find information?
Yes, I go there.
You go to Google? Okay. How do you know that if you look up something, let's say about COVID, that it's good information?
I just talk to it on my phone,
Yeah.
and whatever it says, I go with that.
You go with that?
Well, they have doctors who introduce themselves and they tell about the procedure. So, from a doctor's perspective, they give you all the information that you need about the procedure.
That's great. You're doing all the right stuff. We talked to a lot of people today about getting better access to the healthcare system, especially about using their smartphone. And a lot of people shared with us that they do search for health information using their smart device. And they're really worried about getting fake information or poor information. People have a few different strategies they use to help make sure they're getting good and reliable information.
So, on top of the strategies that they shared with you, remember to also read beyond the title and make sure that the information that the article is sharing with you is reliable and current. And with that, make sure to also look at who the author is and when the article was written.
So kind of to recap some of the information you heard in that video, and I hope the sound came through okay. I know it's a little bit hard to hear. But patient portals are a great way for your healthcare provider to send you good quality healthcare information. And most encounters actually result in some type of a patient handout or discharge instructions. And often these are not printed anymore and they are sent through your patient portal, which we'll talk about in a few minutes. The next is professional association. So I mentioned the American College of Emergency Physicians, but if you're a diabetic, I highly recommend you go to the American Diabetic or Diabetes Association, a very good site for really user-friendly, easy to read information about diabetes. It's really up to date, it's very thorough. The American Heart Association is another great resource. So you can see this trend of finding kind of well-known, credible, reliable associations that actually have leaders in the field as members who help curate and write content that is targeted towards patients that can be understood and helps to minimize misinformation. Practice blogs are another really good way to learn about a variety of, especially emerging technologies. So often surgeons, orthopedic surgeons or neurosurgeons who are in their practice performing cutting edge technology will put on their websites, on their practice pages, either stories, blogs, videos that help describe the work they're doing. And that's another great way to learn about what's out there. YouTube has become an incredible marketplace for health information. And Google, that owns YouTube, strives to have a library of information available. Now, YouTube can be a rabbit hole, and you have to be careful about what you're looking at. And you want to make sure you use the same strategies that we've talked about previously, trying to understand if that information is credible and reliable. We'll talk about that in the next slide. However, Google obviously is one of our search engines among many. And you saw the gentleman who mentioned, he goes to Google and he takes the first choice on the list. We think that is potentially not the best strategy, right? You can use Google to help you identify information, but you should be looking through multiple listings that show up in Google and determine which one you feel is the one that's most appropriate for you to read. It's sometimes difficult to discern between articles that have been paid for or promoted for some purpose versus articles that come up in kind of what we call organic search, just based on how many times they've been searched before or how they've been listed. So looking at some of the details around those articles can really help improve the health information that you're looking for. So credible site organization, I'm listing just one, but many of our news organizations can be credible as long as they're presenting unbiased information or scientific information that we think is interpreted in a clear way. And sometimes that's hard for a patient to fully understand. And that's why if I start from the bottom here, we use our news and media organizations to take very complicated science and try to digest it down into a soundbite that is available for TV or news. That is a challenge. When I was a resident, so 20 years ago, I spent some time with a media agency doing this, and I started to see this process of us taking the latest cutting edge article and having to digest it into 2 to 3 sentences. And a lot of the details and a lot of the nuance and the meaning of that information can be lost if that's not done very, very carefully. And so you have to, I think, be very careful about how you interpret the media's interpretation of scientific research. I think it's great that it's available to you and that you can read it on your own. And then you can take that information to your doctor or other trusted sources to help interpret it. We know that doing science is hard. Well done science can still lead to confusing conclusions. And so having well done science that someone knowledgeable can interpret the conclusions that apply to your healthcare case is probably the best case scenario. And so kind of looking at these blanket conclusions and kind of generalizations can sometimes be misleading. We look at the recency and who has published articles. You're looking for, like the woman said in the video, maybe a physician who's an author or a scientist who's an author. And how recent was that? Was the article from many, many years ago, and now it's being repurposed to bring something up that may be relevant in the news today? Or is it something that's cutting edge and actually was just recently published? There are a lot of caveats to this as well, because during the pandemic, we've seen that lots and lots of scientific information was being released to the public, potentially skipping some of the guardrails that are in place to make sure that scientific information is reliable. And one of those processes is called peer review. And so we were seeing a number of articles come into the public domain that had been fast-tracked for publication because of the urgency of the pandemic. So lots and lots of caveats, lots of information out there. I think if you just turn your radar on and say, wait a minute, I can't just believe what I'm reading. I have to really be critical of it. That is probably the major takeaway here, is being critical of what you read, share it with others, talk about it, and try to come to your own conclusions based on that. The next topic I want to move to is patient portals. So we use patient portals for a couple of different tasks. So accessing information, completing health tasks. These can are the two major buckets that I like to think about. So information that really is in your pocket and now can be moved with you everywhere you go. Incredibly important to me as an emergency physician, because you might be getting care at a variety of different entities across the city or further, and then I can't access that information. But if you have your portal, then you manage and own and control your own information and can share it with me. The next thing is completing health tasks that are sometimes hard to do, and we'll talk about each of those in a second. So I have another video here to share some thoughts from our community about patient portals.
Today we're going to be talking about how to better connect people with the healthcare system.
Sometimes we think about knowing how to use the smartphone. So for example, have you ever used the patient portal? What's the portal? The way that you can control your health information. So you can have your doctor's notes, labs, x-ray results, and you can take them anywhere you want on your phone and share them with anyone you want.
Most doctors' offices, clinics, and hospitals have their own portals, so make sure to check out their website.
And make sure that your doctor has the right contact information. So they need your name, they'll need your phone number, and they'll need your email to match so that you can download your patient portal. And so we're trying to help people get better connected with the healthcare system. And sometimes it's just as simple as knowing how to use your smartphone. So do you use a smartphone to help you with your health?
I have my follow my health account.
That's your patient portal?
Yeah.
Perfect. How do you use the patient portal?
I follow my health account and I check my appointments to make sure I keep them scheduled properly. Also, I message my doctor if I have any concerns about my health.
That's great. Did you find that messaging your doctor saves you time?
Sometimes you can't get them right away because they deal with the patient. So what I try to do is send a message and give them time to
Somehow my video has come up out of sync with the voice. Let me just see if I press play again, if it'll restart.
That's great. That's great. What's the most
my health account. talks about mental, my doctor, if I have any concerns about my health.
That's great. Can you find that messaging your doctor saves you time?
Oh, definitely so. Because sometimes you can't get those right away because they're dealing with patients. But what I'm trying to do is send a message and give them time to respond.
That's great. That's great. What's the most useful thing you've done through your portal?
Being able to schedule appointments, that's great because it gives me a chance to go through my appointments to make sure I don't have any schedule conflicts.
And you don't have to wait on the phone, right? Can you tell us how you use your smartphone related to your health?
I am a great doctor or
Well, I'm going to skip this because I apologize. It looks like it might be my internet connection, but our video is out of sync somehow. I've never seen that happen before. But we'll keep moving on here. So I think you heard some of the stories that the patients were telling us is how do they take advantage of their patient portal. And I think, I don't know, I wish I could poll you all and see how many of you have you downloaded your patient portal. But the patient portal has a couple of different functions. So starting with the accessing information, as I mentioned, the first is who's your care team? And today's, I think patients are often very complex. So you may have multiple doctors who are taking care of you. If they're in one organization, they will be in one patient portal. One of the challenges that comes about is that if you have doctors at multiple organizations, you will actually need to download multiple patient portals unless they're on the same electronic health record system. So, for example, my mom uses GW and some other doctors, but they're both on the Epic system, which is one of our electronic health records. And so she's been able to merge all of her records. But she also recently moved up here from Tennessee. So we don't have all of her records from Tennessee, except through a separate portal. So we're navigating two different buckets of information. But it was really helpful because she was recently in the hospital. We saw lots of different doctors and we couldn't even remember all the names of the different doctors. So by seeing the care team, we were able to now see all the doctors who were associated with her care and recognize their names. The next is doctor's notes. So there are new rules in place that actually make it such that you can see the doctor's notes that are taken about your visits. And I think that's fairly transformational. You can, you can see if your doctor interpreted what you were sharing with them. You can make corrections if there were some egregious errors. But you can also, more importantly, I think, share that information with another provider who may not have access to those healthcare records. There's also the health information there I mentioned, and access to forms and other tools that you might need in managing your health. You can see your upcoming appointments and set reminders. That's extremely important, especially navigating, I think, healthcare in the city is often like trying to figure out where you need to go. And so that type of information will be associated with your appointment within the portal. And then radiology results. So you had a CAT scan or an X-ray or an ultrasound. That type of radiology information can be really valuable to carry with you because it can prevent you from having to have repeat studies if that information is available. If, for example, someone had, let's say, a CAT scan at an outpatient center that doesn't share information, sometimes I have to repeat that scan because I don't have access to the information to know what it showed. And so that's more radiation, that's more cost and more time. And so having that information is really valuable. And then, of course, lab results. Lab results are valuable in their instance, but they're also valuable to trend over time. So again, I take the ER example. If I saw your lab results from today's visits in the emergency department, having access to your previous history to see what the trends have been can be really valuable to my decision making. So these are some of the most valuable components, I think, of a patient portal is the information that you can take with you. Let's see if this video works.
No two health journeys are the same. That's why Geisinger is putting the power to manage healthcare in your hands with My Geisinger, an online portal and app that lets you do just that. Full insider access to your medical profile means you can review test results the instant they're available, check medical records, set appointments and reminders, and even manage your prescriptions with home delivery from our online pharmacy. More than 500,000 users have already signed up. When you register your My Geisinger account, you get access to thousands of in-network doctors and specialists. From there, you can message your doctors and get advice straight from the professionals who know you best. Your information and correspondence are always kept private, and only you can authorize who has access to your profile and online records. It's time to take control of your healthcare journey. Let My Geisinger help you plan appointments, medical records, connect with your doctors, and much more, all without ever stepping into a hospital. Sign up today at geisinger.org/mygeisinger.
So I use that video primarily not because it's Geisinger, but because it shows that these are the common functions and features that most portals have. And it's really important that when you go to maybe your first doctor's visit, especially with a new provider, that you get registered for that portal. Often they need to make that often your registration needs to have your email or some type of a PIN or code set up before you leave, so that you can download the application to your phone or access it on your home computer. If you don't give all that information, or they don't take all that information and set up your portal, you may have some difficulties in accessing it in the future. And it's very frustrating to do that. So it's often nice to think about that at your first visit and ask about it if it's not brought up. So we've talked about what does a portal give you access to. Here we can talk about what does the portal allow you to do that helps you become more efficient in taking care of your healthcare. So these are some of the most important. This is a picture from the GW MyChart portal where you can schedule an appointment. You can also request medication refills. I mean, that's one of the most frustrating things I see, and I think for my patients, to wait in the emergency room for a long period of time just to have a medication refill. So requesting a refill through the application can be really time-saving. Scheduling an appointment, as we mentioned. Messaging your healthcare provider. So if you have a non-emergency type of question, maybe it's something about a minor side effect about a medication, or a symptom that you don't feel is a true medical emergency, then the messaging portal can be the right venue to be able to reach out to your doctor. Also can be more efficient for you than actually being on hold on the phone or trying to reach your doctor during their busy workday. And then they can have someone, either themselves or someone on their team, respond to your question, usually in a very timely fashion. You may have copays or other bills or deductibles that you need to take care of. Those can often be done through these portals. You can track your health data. For example, recently we enabled a feature at GW where you can upload your blood pressures, and the doctors can see the difference between the blood pressures that have been collected in the office setting and the ones that were taken at home, but they can trend them together. That can be really valuable, as we said, in making decisions around managing your medications. Requesting a referral. So sometimes you need a referral to a specialist, and you hate to have to go and see your primary care provider to actually get that paper referral. This can be done electronically and can save a lot of time and effort. And then finally, completing a telehealth visit. So, telehealth really exploded during the pandemic, but it was kind of done in a bit of a piecemeal fashion. We were all reacting to the development of telehealth services that were required during the pandemic. But now we're seeing many more integrated services. And now at GW, for example, we used to use Zoom, where you would have to get a link to Zoom and log in like you're doing tonight for a webinar. However, now it's all integrated into the patient portal. And so your appointment is really just a click away if you can log into the portal. So I want to move on to our third topic about telehealth visits. So this survey came from, there's a Center for Aging at University of Michigan, and they had a survey of patients who are age 50 to 80 who they talked about telehealth visit concerns. You can see here in this graphic, 75% said healthcare providers are not able to conduct a physical exam. Well, I want to address each one of these points for you briefly. That is true. You cannot conduct a physical exam through telemedicine in the same manner that you would normally conduct a physical exam in person. But there's an incredible amount of information that you can get through a telehealth visit if you're trained appropriately. And that's my job, is we're working hard to try to train our providers, our students, our residents now, on how to do good telemedicine visits that allow them to accumulate the information they need. Now, it's not completely a replacement for an in-person visit. And I think the understanding should be that, and this is the understanding that I set with my patients when I do a telehealth visit, is that we know that we have some limitations in telehealth. We know that there are some joint goals that we're trying to achieve for this visit today. And we'll work together to gather the information we can to do the best we can. If we can't make that decision based on these limitations, then we may need to add in a in-person visit to finalize those decisions. But often, very often, you can make these decisions based on kind of the history and the limited physical exam that you can do. I can do very thorough neurologic exams. I can do reasonable skin exams and observations of the throat and other parts of the body. I can't listen to your heart and lungs, which may be important. And so in those scenarios, I may need you to come in to see me. The other thing that can enhance doing a physical exam is having a family caregiver, what in the telehealth industry would be called a telepresenter, someone who can help present the patient to the doctor or be the extension of the doctor. And I think when you think about a patient who may have chronic disease, an ongoing cancer diagnosis that has very frequent visits to the doctor, helping your family caregiver or caregivers learn about how they can be the extension of the doctor's hands can really enable those visits and make them even more valuable. Our system has not yet kind of expanded to kind of efficiently do that. But these are conversations you can have with your doctor and say, hey, maybe every third visit we can do it virtually. And, my family caregiver, you can teach my family caregiver some of the information you're going to be looking for, and they can help you get that information. So there are really an immense amount of opportunities for us to learn more about how visits can occur during telemedicine and how we can increase their value. But it all takes collaboration between the patient and the provider. The next is that the quality is not as good as telehealth, in telehealth as compared to in-person visits. And this, I think, is also a misperception. It really depends on the reason we're having a visit. So, for example, if you're trying to get a medication refilled, I would argue that telemedicine is equal or better quality because really you're communicating about medications. You don't need to have the time and effort taken to go into the office to accomplish this goal. It can save everyone time and be more efficient for you. But there are a number of other scenarios where potentially managing blood pressure can be done virtually very well because we can have more touch points. Rather than expensive visits that take a lot of time to come in and get your blood pressure checked, we could check in with short visits very frequently and make treatment decisions that may be better informed than they would be in those intermittent visits instead of these continuous types of visits. And in some scenarios, the comparison of a telehealth visit to an in-person visit is not the right one. In some scenarios, the comparison is a telehealth visit to no visit at all. And so that's another thing to consider. If I'm not able to get to the doctor for some reason, whether that's a mobility issue, a transportation issue, or an access issue for other reasons, then the telehealth would be compared to actually having no visit at all, and I think could really add value. Or it could at least help you triage your decision-making to maybe going to the emergency room if something is more severe, or staying home if something is less severe. So a lot of ways to use that information. The next one, not feeling personally connected to the healthcare provider. I think this is obviously a personal preference, but I will say that in most scenarios that I've had with my patients, I find that telehealth can actually be a very intimate way to talk to my patients. There's a lot less distractions for me in the clinical area. We're not in the same room, but we really get eye contact. We get a very one-on-one interaction. And I've had some patients who've had very complicated medical issues, and we had a couple visits as outpatients that weren't as productive as our visit online. So I think this again comes down to a case-by-case scenario. Difficulty hearing and seeing healthcare providers is a huge challenge. We have to work on that, and we'll talk a little bit about some of the ways that we can optimize that. And then privacy concerns. So, there are also some skills that both our healthcare providers and our patients should know that can improve privacy. But the main thing is that you should know, in general, healthcare practices follow HIPAA guidelines. HIPAA guidelines are security and privacy guidelines in place to protect your health information, and they apply to telemedicine. So when we use platforms for video, they should be encrypted and secure. When we do video, I should be, as a provider, in a secure and private place so your information is not shared with anyone else, and so should you. So how do you prepare for a telehealth visit? The first thing, I'll go through these 5 or 6 bullets. There are lots of different things you should be doing to prepare for any doctor's visit, but we'll really focus on the skills that help you prepare for a telehealth visit. So you may be conducting your telehealth visit through a tablet, a mobile device, or a laptop or a desktop computer. You'll want to make sure your technology is on well in advance of the visit, and you want to check the microphone in the video if you can. Often practices will have someone that you can do a practice call with or a check-in with just to make sure everything is working, because you want it to be smooth and efficient for both you and your healthcare provider. You should think about headphones. In some cases, we talked about the limitations of sound. Headphones can be really helpful in helping you hear each other. The other thing that headphones can do is help ensure your privacy if you don't want someone to overhear what the doctor is telling you. Make a list of questions. That's always helpful for any doctor's visit. Be prepared for it in advance. Have your medicine bottles available so they can be viewed. And have your family caregiver on the screen if you want. This is something that you have to navigate. But I would say in the scenarios where my patients have a family caregiver and they want to include them in their care, I'd much prefer them to be on screen and with us rather than off screen and the patient looking to the side all the time with someone whispering in. That's always a challenge. I'd rather include everyone in the conversation. Now, sometimes technology enables us to bring in family caregivers who are out of town. And that's even better, I think, because you can include family members who haven't seen you in a while or may have lots of questions that may be hard for you to relay to them after the visit. So including them is almost always a possibility. We can have multiple patients. So we can have a patient with multiple family caregivers in a video consult, just similar to the webinar we're doing tonight. Before I go to take your vital signs, I'll mention that if you are using a tablet or a mobile device or even a laptop, sometimes having a second device can be helpful. For example, one day I was examining someone who had ankle pain through telemedicine, and I really needed to see something on their ankle, but their screen and their webcam was up here and they couldn't position it down. So I had them log into the video on their smartphone and mute the sound, and then they could basically take their hand and move the camera down to their ankle. And so I could actually see their face and I could see their ankle. And it was really helpful for me to facilitate my examination. So you can kind of see it's really up to the creativity of the doctor and the patient to work together to examine things that you would almost always, you would think inherently are not easy to examine. In preparation for your visit, taking your vital signs is another really important factor that I think can help with managing your health and improving your telehealth visit, depending on the condition you're there for. In most scenarios, if I was evaluating someone with ankle pain, I'm not so worried about your blood pressure. It's not critical for my decision-making. But someone with the multiple chronic diseases, heart failure, hypertension, high blood pressure, diabetes, those types of conditions, I think it's really important to have some vital signs. So we're looking at a blood pressure here, and I like to have the blood pressure done. So you take your blood pressure before the visit, you have your blood pressure cuff available there, and so the healthcare provider can see the numbers on the screen. That's really, I think, the best way to do it. The other vital signs that you might consider are some of the self-tracking data we talked about before. How's your activity been? How's your diet been? You might want to record that and have it available. You might also need to have your weight available, especially if you have heart failure and we're worried about like a volume status or having too much water on board. That can be represented in weight. The other area where I think it's important to have height and weight available is if your doctor's never seen you before and you're seeing them for the first time on video. It's really hard to estimate the size of a person just on their shoulders and up. And so if you have a height and weight, it kind of gives your healthcare provider a bit of a sense of your size. The other useful part of a telehealth visit that does not happen when you have an in-person visit is that your healthcare provider gets to see the environment you live in. And so we can take if we're willing, we can take a look in the fridge and see what you're eating. We can see if there are if the place is messy and there's a fall risk, and we need to think about how do we reduce your risk for falls or other types of factors. How's the light? Things like that. So a lot of different information can be garnered through a telehealth visit that may not be available in an in-person visit. This is a tool that we developed at GW to help some of our patients gather the information they might need prior to a visit. Nothing magical about it, but just a way to organize all the things we've talked about. So who's the provider you're going to see? Maybe your temperature, if that's relevant, if you're have some kind of acute illness, but your blood pressure, your heart rate, your weight, a list of your medicines, or bringing the medicine bottles to the video side. Any questions you might have, and then a couple tricks. Maybe you're coming for a sore throat. It might be helpful to have a flashlight, or if you're looking at a rash, maybe having an extra light to brighten up what you're trying to display. And we talked about an additional smart device to add a second camera. Now we're coming down to time here, so I want to just finish up. This is a really important slide, maybe one of the most important slides that's not very obvious to most people, especially not obvious to new telehealth practitioners on the provider side. So what this shows is that lighting is of critical importance when you're doing video. And often we think that, oh, let's sit next to the window. It's nice and bright and sunny here. But honestly, natural sunny light is the worst possible place to do a video or telemedicine visit, because you can see on my side here, the leftmost backlighting picture, the natural light actually darkens this patient's face, and I really can't see her at all. And so I'm often telling my patients, I see you here, I know you're comfortable next to your window, but let's move you somewhere else because it'll make it a lot easier for me to see you. So natural lighting is actually bad. I would close drapes and windows and move a lamp forward. You'd like to have light kind of near in front of your face. Hopefully I'm fairly well lit for you, and I have a lamp right in front of me, and that really makes a big difference, because when I don't have it here, things get really dark. You don't want to be overly harsh, but I'd rather have harsh and bright lighting like this middle picture than having poor lighting like the left picture or the right picture. So if you have a light that's only to the side over here, it makes a great shadow on your face, and you can see how much difference it makes when I see the patient. So if I'm worried about things like a stroke or a sore throat or a rash, you can see how it would really make it more difficult for your healthcare provider to interpret what's going on. So good lighting is something really worth thinking about. And you can always ask, hey, ask your provider, is the lighting okay for you right now? Do you need me to move somewhere, or should I adjust something so you can see me better? That way you're being your own advocate, because sometimes, like I said, doctors are not always trained in optimizing lighting themselves. And so now that you know about this, you can bring it up to them. These are the types of things we're working on training people about. Go ahead. Oh, and we talked about private and quiet locations. So I always advise our doctors not to have a door behind them, because that would interpret to me as a patient that someone could walk in on us anytime. So kind of the same thing for you as a patient. You might want a private place, or at least tell us who's in the room and that it's okay if they hear. Or if you'd like to exclude someone, that's your right. We can ask them to leave the room so you can have your privacy for your visit. All right, we're here at the end. I wanted to talk just briefly about some of the skills that we really focus on at our help desk events. So help desk is this entity we use to try to improve digital health literacy. And these are things that you may know, or you may be really interested in learning about if you don't know. And you can often ask someone else who might know, and they can teach you, or we can help you learn them. But the things that I think are critical is making sure you have an email address, that you know how to make calls from your phone and know how to answer text messages. That type of communication obviously has become very common, and it's important that you're comfortable with it. And if you're not, we can help you. Using your camera, connecting to a Wi-Fi setting, because often that gives you better connectivity than using a cellular connection on your phone, doing a browser search, and adding a lock screen to your phone to protect your privacy. Almost every phone has the ability to put a code on it so you can protect your privacy, and that's often left off. I have a video where we asked people in DC whether they even put a lock screen on their phone, and many of them said they didn't. They didn't worry about it. But I will tell you, there's a lot of issues with cybersecurity. I think it's incredibly important, especially if you're going to put your patient portal on your phone. You need to have a lock on your phone. You want to have that double set of security that no one can access your health information or any of your other banking and other private information as well. I would love if you learned how to add contacts into your phone and organize them in a manner that not only you would understand them, but your healthcare provider could understand them. For example, If you have a power of attorney who's a spouse or a son or a daughter, label them well in the contact list so that if there were emergency and you were not able to communicate, but we could open your phone, we could identify someone that we need to reach. There's also a feature in both Android and Apple phones that's called in case of emergency. I highly recommend you fill that out because it can take, and what you can put in there is your name, your date of birth, any allergies to medicines, any critical things that need to be known. And it can be accessible without the lock, even with the lock on. So like an emergency provider, like an ambulance or EMS personnel can access that information, at least know your name and any allergies before they give you medications. I think that's one of the most valuable features of smartphones, but they're not valuable if they're not used. So it's important to fill them out in advance before you have an emergency. One other thing I'll mention is changing your font size. So I have noticed my vision has been changing significantly, and it's harder for me to read close up. So every phone has the ability to increase their font size, and that can make it easier for you to read your messages, your emails, and access the various tools on your device. So there are settings in your phone that you can increase your font size. And then on the last panel here, I have what are some of the more advanced features that I think are important for people to have on their phones. And those include the patient portal, which we spent a lot of time on. There are a variety of apps that might be useful to you, things like meditation, things like mindfulness, tracking, communication, medication adherence and compliance. There's a variety of different things that might be useful to you in your scenario. And you have to find the right tools that are beneficial for you. And then the last is connecting a Bluetooth enabled device. So we've talked about like having a blood pressure and being able to show the screen. But wouldn't it be great if every time you took your blood pressure, the data just gets sucked into your phone and it's all available in the electronic health record already? Sometimes that can be really challenging to get the connections to work. But if it's important to you, it's something that we can help you work on. So that ends the kind of the slide didactic portion today. And I appreciate your time. I hope you have some questions. I'd love to talk about this more. And I'm also going to put in the chat a 10-question short survey about your interests in technology for healthcare and any suggestions you have for us for topics that we could teach.
So while you're doing that, Neal, let me just thank you. This was excellent. And I know that you raised a lot of good points and shared a lot of good information that our members can use on their visits. I do want to mention to our members that, of course, we have people that can help you with the information that Neal was sharing about what you need to know for you to use your smartphone, how to enlarge the font, how to get some of the apps that you'd like on there. So don't hesitate to call the village if you'd like some assistance with the technology aspect of this presentation. Having said that, I now open the floor to questions. If there is, you have any questions, please raise your hand. I see Carol, your hand went up first. So you have already unmuted, and please go right ahead.
Neal,
Thank you,
next.
Doctor.
Sorry, Carol.
Yes. Oh, Hans, how are you?
Good, thank you.
Good. Are you going first or am I going first?
You go first.
There you go.
Okay, thank you. And thank you, Doctor, for joining us. I'm president of Georgetown Village, and I've been involved in health policy for more years than I care to comment on at this point. And I personally worry about the fact that younger generations grew up with the technology that is pervasive throughout how we live now, but older people and disabled people are more likely to need healthcare services and frankly have more problems and issues with the technology. So seeing someone like you focus on this and try to bring it into your day-to-day practice is incredibly important to your patients and more generally. I have just a few suggestions of notes I wrote down quickly, and if you have any reactions, I certainly welcome them. Talking conceptually about a patient portal is wonderful. If there's anyone, if you or anyone on your team at some point could actually demonstrate how these things look when you actually go in and use them. I use Epic through my provider, but there are probably functionality there that I haven't even recognized yet, but I have personally found it very useful and I do use it. Another step that might be interesting is to take a patient with certain conditions searching for certain information online and actually, seek out that information and help somebody search it and look at what comes up and how to make those choices and how to interpret it for yourself. Because I know so many of what comes up right away are sponsored sites, and you really have to go through information to see, have a bit of a background to see what it is that, really should be useful to you. And then the last thing I would say is your sound bites are great. If we get them clear, I think it'd be wonderful if we could try to use them more broadly and with our members, because people learn now, especially in the conditions we're in now, in short sound bites. So that would be incredibly useful too. So just a few suggestions and a great thank you to joining us this evening. We look forward to continuing to work with you.
Thank you for those comments. I absolutely agree. Talking about it versus doing it is a big difference, and we'd love to do that and help you. What we found when we did pre-pandemic, we were really out in the community quite a bit, and we really found that you need like a 20-minute coaching session to kind of focus on one or two topics, and so it's often one-on-one time. And we talk about kind of our young providers, even though they're digital natives, they don't know necessarily how to apply technology to improve healthcare, and then how to work with folks who may be not as facile with the technology. And so they need help too. And so this combination of having our trainees and our residents and our doctors actually work one-on-one and coaching a patient, maybe outside the clinical setting, actually outside of a visit, because there's less time pressure, is beneficial to both parties. And to the videos, I apologize for the quality of the videos, but we have a whole series of videos on our website. I'll just put that in the chat for you if you're interested in looking at any of the others.
Thank you. And I should mention that we are saving these links and they will be mailed out in our email blast on Sunday. So both your survey link and the link to the videos will be shared with the members in our email blast. So thank you very much. I think Hans, you had a question, and then Fred, and then I see Gloria electronically raised her hand. So that's the order so far.
Thank you.
I think you went on mute.
You somehow muted. I apologize if I accidentally did that. Okay.
Yes, you did. Thank you. So again, Neal, thank you very much for a very interesting talk. I have been using the portal at George Washington. I've also used it at Georgetown and at Sibley. Fortunately, Sibley and George Washington are connected through Johns Hopkins, but Georgetown is not. I see that as a problem. There is apparently no way to connect one to the other. I'm sure that has to do with privacy, but is there any way to merge that information?
Yeah, that's a great question. So this comes down to really the electronic health record industry. And today there are really two major players. One is Epic and one is Cerner. And GW and Sibley and Hopkins are all on the Cerner platform, and Cerner has enabled different organizations that have purchased their platform to share information. But between Epic and Cerner, which MedStar uses, there's not that connection. So that's a problem. I would say the good news on the back end from a provider's perspective is that that the District of Columbia and Maryland and a number of other states surrounding us have something called the CRISP network, CRISP. It's basically a health information exchange. And while the patient portals do not connect to each other, certain data like X-rays, some clinical reports, and some laboratory data is available to me that has been done at these other settings. So I understand your frustration. We all have that same frustration, and we wish there was ways to improve it. And I think they will. You know, the Office of the National Coordinator, ONC, is where a lot of these decisions are made for healthcare and interoperability. And you know, obviously the best thing you can do is advocate for these things, raise these issues with your representatives, and see if change can be made.
I have, don't worry.
Excellent.
Thank you.
Thank you. Okay, Fred.
Question, Neil, about money. So much of this is going to be driven clearly by the reimbursement issues. And I'm worried about it. And so I'm asking whether you would comment from your knowledge base about the recently passed Advancing Telehealth Beyond COVID-19 Act, which the House voted in a bipartisan way to pass. But I haven't heard much coming up out of the Senate yet, because that's going to be critical for all our members to make sure their telehealth visits are reimbursable.
Yes, that's a great point. This is another area for advocacy. We need to hear patients' voices. The Congressional Budget Office has made an interpretation that telehealth may be additive services and not substituted services, which could result in a lot of increased costs. And so those of us who are doing research in the telehealth field are kind of scrambling to accumulate data that supports the fact that some of these, some of the things we talked about, that telehealth has good outcomes, that it provides high quality care, and it doesn't increase costs of care. And really all the data has supported that quite well, that a telehealth visit actually results overall in probably equal or less cost. It's just very complicated to tease out these types of things. And during the pandemic, what enabled us to do so much telemedicine was that before the pandemic, telemedicine was only reimbursed by Medicare if you were in a rural area.
Right.
And if you were not at either a rural area or not at home and in a hospital that qualified as in a rural area. And so the pandemic waivers enabled us to see patients at home, and that's what we're pushing for. This has been a big fight for a long time. I don't know what's going to happen in the Senate. I think we need to hear more voices of people clamoring for it. A lot of people are optimistic that something will happen. It's going to be very hard to peel back what's happened during the pandemic, but it's still a big unknown. I was at a policy conference just on last week, and I felt like it was 10 years ago, the same conversations. We're hoping this will happen, and we haven't seen it yet. So advocacy.
Yeah, thanks.
Thank you. Yeah, always the name of the game. Okay, Gloria, I see your hand raised electronically, so please unmute and ask your question.
I'm ready. So I have a question. You mentioned very briefly about doctor's notes. It sounded to me as if you said newly available. I'm with the Kaiser HMO, and they've been really quite good and early and connected with the Hopkins portal. And I'm noticing doctor's notes being made available to me, which are new, and no one's mentioned it. It just happens to be there, and it's extremely helpful because I don't have to, I'm a note taker, and I don't have to sit in the office scrambling to take notes when they're looking at the clock. So can you explain how that came about?
Sure. I'm not a policy expert, but I believe that doctor's notes being made available to patients came through the 21st Century Cures Act. That is what required healthcare providers to make notes and actually laboratory data and radiology data available to patients. So I see this all the time now. I think it started in October 2021. But I could see someone in the emergency room order a test, the blood test result will come back in the portal, and the patient's already seen the result before I've had a chance to talk to them about it. So that can cause a little bit of awkwardness, but I agree with you. I think it's very empowering. I don't have a problem with it. We have to be collaborative with our patients and make sure that we can talk to them about their results, even if they get them a little bit sooner than we expect, and help them interpret those results. But that I believe is the correct. If you want to look into it, I'm pretty sure that's the right legislation that enabled notes to be made available.
Thank you. Are there any other questions? Dr. Sikka has been very generous with his time. It is after 6:30. I'm sure there's a dinner waiting. Fred, I see you have your hand up.
Quick follow-up, because there was an excellent perspective piece in the New England Journal a few weeks ago one of the issues that was brought up that you introduced, Neal, is how we think telemedicine advances health equity. I'm very worried about our inner city populations. I'm very worried about those areas that just don't have a decent internet connection. And how can we advocate better to incorporate support for those issues to improve health equity?
You're asking the toughest of the tough questions. I mean, I think first of all, knowledge is power, and I while we may have known these issues existed before the pandemic, they are kind of in the common domain now. Everyone is talking about them, and so I think that's the first step in trying to tackle these equity issues. We also know, when you look at, you're absolutely right, internet connectivity. Even cellular connectivity in certain communities, and then access to services, and then again the digital divide, the knowledge base. These are all things we have to tackle. The other issue is that often communities that don't have those services also don't have brick and mortar services available, and so telemedicine may actually enable them. So I think judicious use of telemedicine, if we are maybe not judicious, it's purposeful, right? It's like very purposeful and thoughtful use of telemedicine will allow us to try to avoid those pitfalls. But being aware of them is really the main thing. And when I talk in the circles of folks who are leading telehealth programs around the country, especially at academic centers, this is at the forefront. This is why why we created Health Desk. These topics are at the forefront and are being trying to be addressed as much as they possibly can. And again, we need help. We need more advocacy for money. We need to make sure that the FCC is getting broadband into all communities. And we need to make sure it's affordable for everyone. So there's a lot of those factors, and some of those fall outside of healthcare, and we just have to collaborate with those in the ICT sectors to improve it.
Thank you.
Thank you. So thank you again, Neal. Thank you very, very much. This was a very informative, interesting, and important program. Fred, thank you for arranging this for our members and volunteers. This was a member-only program, a benefit of being a member of a village. We will be sharing the link to the recording on our website and on our YouTube channel. So for anyone who has friends that are not part of the village that would like to learn about this, feel free to send them to our YouTube channel and tell them to join the village, or a village, because we did invite other villages. Our next CCC program is scheduled for January 19th. We have Mark Nadell speaking about Social Security. Why should I worry? I think it is a topic of interest to all of us, and we hope you will join us for that. So again, thank you very much, Neal, for your time. Thank you all for attending, and we know you found it valuable. Have a nice evening. Stay warm, stay dry.
Thank you. Bye-bye.
Bye-bye.